So with me now, in the heat of the QE2 building at HBI 2022, the summer event, is Somesh Chandra, who's CEO of Employee Benefits at the insurance group AXA. And you recently launched a new subscription-based digital health platform. Why? What's all this about?
So let me start with a bit of a context of where we are today. If we look at the healthcare ecosystem today, we are at a very critical time. And I would say three reasons why it's quite important at this point of time. Post the COVID pandemic, we do know that the social systems are quite overburdened and they cannot take more. But then when you start to think about medical inflation, which is 3 to 4 times the GDP growth, the problem starts to become a bit more complex. And on top of it, if you add the fact that in Europe alone, 25% of the people spend more time in unhealthy state during the latter half of their life with multiple chronic conditions. So I think the concept is quite clear right now. We need to do something now. And what we have launched with the DHP is a step in that direction of how can we create better health outcomes for society in general.
Are you looking to other models? Because other countries have done this. Places like Finland, Romania, Poland have done the employer-paid healthcare benefits for their people. Is that the sort of model you're looking at, or are you designing something fresh here?
No, so I think what we're trying to really do here is a lot of what we offer in every country, and though we say Europe as one, it changes quite a lot country by country. So if we think about the social systems in different countries, we are trying to complement what the social system offers, and on top of it, then work with the employers on how we can start to design solutions which are relevant for not only for the corporates, but also for the employees. And then think about what else is needed for the employees to buy themselves off the shelf. Because in many times, employers do not cover family members or parents. But when we think about employees, actually, they're looking for an overall health solution for their whole family. And that's the reason why we are quite focused on complementing these three different systems together: the social system, what the employer offers to the employees, and what the employees need for their family. We're trying to bring all of that together. And at least in our view, the way we see is that in many countries like Spain, Italy, Mexico, the out-of-pocket spend is going up. And since that out-of-pocket spend is going up, employees are worried about their health of their families. And that's the reason why we want to bring all of this together to offer a comprehensive solution to the employees.
And we were hearing in an earlier session today about this, about looking to be more preventative. So the insurer is getting on board earlier in the chain before somebody's chronically ill. Preventative measures, well-being measures. Is that the trend?
Yes, absolutely. I think that's the only way. As I was talking about inflation and the cost of care going up with social systems, I think we have to start thinking for the future. And that's why I think there are three very important topics. One is, of course, as you mentioned, prevention. But even before that, it's awareness. How can we make our citizens in general aware about health issues? And the COVID pandemic has helped a bit on that because people are now very aware. One of the surveys that we did at AXA, when we asked people, how aware are you about your health and what would you do about it? That number has gone up from 30% to 70, 80%. So there's a big jump in that. But also at the same time, what we really want to do is make sure that people think about health holistically. So for example, mental health is a big topic today. And unfortunately, as an insurer, we see it all the time. The impact of mental health comes only after a very long period of time. And we don't want to be in a situation where we're treating a mental health issue. So management of stress and things like that. So that's the second big pillar that we're focusing on. And the third one is actually about how do we manage our day-to-day lives better? If I have a stomach pain, what do I do? Where do I go? It's that whole maze that we're trying to simplify through a very personalized experience.
But by being subscription-based, you tie your customer, your client, your patient in for the long term. Now that suits you. You get regular income, for your projections. But is that what the customer wants? Do they want to be tied in, or would they rather buy off the shelf when they need some help?
So I think it's a combination of both, right? So I think it's the beauty about the healthcare industry is that a healthy consumer creates a healthy business, creates a healthier society. So I think the way I think about this is that we have worked for too long in a very fee for service model. So I think we have to start thinking about outcomes. And when we start thinking about outcomes, saying, if a customer has come to me because they're not feeling well, have they recovered? And I'm sure that if they have recovered, they would love to pay, because that's what they want. But if you're charging fees for people to go to another doctor to find another solution or go to another place, that's not how customers want to be treated. And I think that's what we have to focus on, is when we address the problems of the customer, are we really solving their problem? And it should not be a transaction. That's what I was mentioning. It needs to be personalized. It needs to be outcome driven. And once we reach that stage, I think the subscription-based models can add a lot of value, not only for the individuals, but also for the society in general.
We shall see where that goes. Really interesting to hear about that. Thank you so much, Somesh Chandra from AXA. Thank you very much for joining us.
My pleasure. Thank you.